microphones off and your videos. There's a question and answer box that you can post all your questions that you've got. Please don't put it in the chat box because you respond on the chat box. And also there's a community of practice where you can also put all your questions in, and we will answer them as soon as we possibly can. I just want to welcome the panelists from Africa CDC, from WHO, from ICANN, and then all the participants that have joined us today. We are going to display the QR code as well for your attestation. So if you can just please remember to download your social participation app and then scan the start code that we're going to display now for you. And as soon as you've got the code to display, you can scan it. And as soon as you scan it, it will tell you that you've joined the session. And at the end of the session, we will also then show you the end code, which also we already posted on the Telegram. I see that somebody raised their hand. It's difficult for us to answer your questions by raising your hand, so please put your question in the question and answer box, and then we can take it from there. I'm going to give you 2 or 3 minutes to just scan the code that you'll be able to get your attestation. So please don't raise your hands, just please put your questions and your answers in the Q&A box, and we will take it from there. Thank you. So Sunday, please put your questions in the Q&A box that you will see if you raised your hand. And if you've downloaded the app, you go to the middle button. And I'm just going to show you how the app will look like. So if you downloaded the app, it will come up with this, and you press the middle button, and it will ask you to scan the app, the QR code, and then this is what you will get, the QR code to scan. As soon as you've scanned that, it will tell you that you've joined the session, and at the end, you'll be able to scan the end code as well. I see somebody said they've downloaded the app. We will try and get you to help, but just please download the QR code as well, and we will be able to help you afterwards as well. Thank you. Okay, I'm going to stop sharing my screen now. And then I'm going to ask Susan to take us forward. Susan Kesey is from Africa CDC, and she's going to take us through on the update. Over to you, Susan.
Hello. Can you see my screen?
Susan, just increase your volume. We can't hear you very well.
Okay, can you see my screen?
You can see your screen and you sound much better. Thank you.
Yes. Okay. Good afternoon to the East and South Africa, and good morning to South Africa. Welcome to Africa CDC ICANN IPC webinar for COVID-19. My name is Susan Kesey, and I work for the Africa CDC. I will take you through the epidemiological situation as of this morning, 26 August. The slides show epidemiological situation for COVID-19 globally. The map to the left shows the distribution of COVID-19 cases by country across the world. The darker black color indicates the countries that have reported over 300,000 cases since the pandemic began in January. 13 countries have reported over 300,000 cases to date. The panel to the right is an epidemic curve showing the trend of COVID-19 cases reported daily by the 6 World Health Organization geographic areas. The slide shows the epidemiological situation of COVID-19 in Africa. The figures shows the distribution of COVID-19 cases by regions of Africa and date of the reporting since the beginning of the first confirmed case, and with a 7-day moving average. The red line in the curve shows a 7-day moving average. As of today, a total of 1,202,910 confirmed cases have been reported, and 28,276 people have died, resulting in a case fatality rate of 2.3 to date. 931,057, which is equal to 77% people have been recovered from COVID-19 across the continent. The slide shows the COVID-19 new and cumulative cases, deaths, and recoveries by regions of Africa. This slide shows the distribution of COVID-19 cases by country in AU member states. Majority of the countries, that is 32 countries in the AU member state, still report below 5,000 confirmed cases, while South Africa reports over 500,000 cases, and Egypt, Morocco, and Nigeria report between 50,000 and 500 cases. This slide shows the cumulative number of COVID-19 testing in Africa. As of today, a total of 11,185,177 tests have been conducted in the continent, with a positivity rate of 11%. The test per case ratio to the continent is 9. This slide shows the member states that are imposing travel restrictions. We can see 20 countries have full border closure, 4 have international air traffic closure, 5 have travel restriction to and from specific countries, and 28 have entry and exit restrictions. This slide shows different guidance documents that are developed for IPC. We have 7 guidance documents that are developed by Africa CDC to support member states in the response against coronavirus. We have guidance documents from preparing the isolation ward, and guidance documents on PPE, on face mask, hand washing, and guidance on environment decontamination in the context of coronavirus. All these guidance documents can be found in the Africa CDC website, and also we will share these slides and you can see in this slide for ease referencing. Thank you so much.
Thank you so much, Susan. It was great to get the update. We will allow all the questions at the end. So if you do have any burning questions for Susan, please put it in your question and answer box, and we will answer it from there. I'm going to take you through now to the next session that we're going to talk, and we're going to talk about the IPC for the first responders, and that could be anybody from the emergency services, the firefighters, anybody from the accident and emergency units. So I just want to share my screen with you. And just go to my slideshow. So what we wanted to do is, in the past we've always talked about the healthcare workers, and sometimes the first responders are exactly healthcare workers, but it could be anybody that are responding to a call. It could be the fire or for a house problem. It could be the ambulance services, and also at the accident and emergency unit, or the casualty units of departments, or even a doctor's rooms where they need to respond to people that come in and wanted to get help. So what we wanted to do is we want to see that there's certain changes that needs to be done. We want to see how we can help them to protect themselves and how to protect others. And then also burnout is, and their mental health is becoming a big problem, because we are now into the 6th month of the pandemic, and there's a lot of extra stress and burden onto our healthcare workers and also our first responders. And we need to look at that. And then also for our correctional services, just a short talk onto that, because that's an issue for us over the times. So if we look at the first responders, is normally they need to understand that the coronavirus, and as we said before, is a respiratory illness that is caused by the virus called SARS-CoV-2, and the symptoms often included the cough, shortness of breath, fever, chills, muscle pain, and a new or a taste, smell that we found. The understanding is also that we are learning every day more and more about it. At the moment, it's a contact spread, only airborne spread when we are creating and we are busy with the aerosol generating procedure. So we need to understand that there's two common routes for people to be getting infected, and one of them is they're getting in contact with the secretions that can be directly transferred into the mouth and the nose of the people that are within a short distance, and that's also why we talk about social distance or physical distancing. It's also possible that sometimes people get infected by touching a person that's already been contaminated. And we need to understand that that's why we talk about hand hygiene as one of the most important aspects of IPC, and not just during the COVID. But we also need to remember that COVID is not Ebola. So therefore, we need to think about the different types of precautions that we need to take. And the excessive use of PPE designed for EVD is unnecessary and is mostly a waste of valuable resources. And we keep on seeing that there's a big need and a big fear under healthcare workers, and it could be first responders as well, by just adding on extra PPE. And we want to address that issue by making sure that people understand what to use and what is the recommendations specifically to COVID-19. But at all times, pre-hospital EMS personnel should strictly adhere to the applicable standard precautions, and also according to the agency, the protocols, the policies that are in place. And we also need to make sure that they follow the precautions according to the suspected or known conditions of the patient that they are going to be getting into contact with. So a suspected patient, normally you will have standard precautions and then add on contact and droplet precautions, which is part of our transmission-based precautions, if you know about IPC. And then also when you are thinking you might be doing an aerosol generating procedure, you need to add on airborne precautions. So first we need to think about everybody that might be involved, and I've just spoken about at all the different units. And we need to also remember that it could be also the responders at a doctor's rooms, or even at a community center, or at old age homes, or anywhere where they might be the first person getting in contact with somebody coming into there. So one of the recommended actions we want to talk about is to say, not just about infection control, but also we need to think about the different departments and the different procedures that we normally. So for the EMS and for the emergency response people, they normally have a call center, and at the call center, they would normally ask certain questions when that call comes through for assistance. So what we need to make sure is that there need to be a change in the type of questions that these people will ask, so they can get a bit more clear idea of what to recommend to the responders that are going to go out, how to protect themselves as well. So we need to add in the type of questions that we would ask our patients when they get to a doctor's room or to any facility where they ask you, have you been in contact? Have you had fever? Do you have a cough and chills or anything like that? So we want to make sure that the EMS personnel that's going to go out are prepared for what they might get into contact with. And then also we want to make sure that the employees make sure that our staff are completely equipped with the correct PPE that they needed, and any other supplies. And by that supplies, we're talking about hand hygiene, alcohol rub, the waste management process that they would need to add into all their waste that might be generated there. We need to also think about screening all of these staff for signs and symptoms at the start of each shift. We need to make sure that we have access to all patients that are possibly infected, that we know what is happening. We need to encourage physical distancing and the universal or standard precautions, which is always the first to be able to do. So what we also want to do is that we need to think about them needing to think in our districts or in our provinces or in our countries, that the municipalities and also the local authorities need to coordinate with national and international and departmental level of what is happening in the public health sector, and having in contact with all of these call centers, that we also can make sure that we all got the same questions that we are asking, and we understand why we are asking them and why this information is very important for our responders, because that information could really help the responders to respond immediately and in the correct way by protecting them and the patient. And then also to make sure that even when they go to the airport to pick up people, that they need to also understand what is happening there. And that is will come into contact with the police as well when they respond to any ill travelers coming down by airports or ports. And in most of our countries, we know that most of the airports and the ports are still closed, but sometimes on our borders, they are still open. And if there's a station where there might be a quarantine, where they need to think about how they're going to allow these people and what are they going to do. So also we need to make sure that they also have the correct PPE, and they have the knowledge and the case definition of what is COVID-19, and as it is changing, that they have the newest up-to-date case definition available for them. We also want to make sure that they know exactly how to take precautions, and if they're getting into contact, if they can talk to the patient by making sure they've got that physical distance of 1 to 2 meters before they're starting to do anything to the patient, if it's allowed, and they can actually assess the patient from there and then take it to discuss with the patient what is the position. But we also need to understand, can I just ask somebody if has got their mic open to just mute themselves as well, because it's interfering at the moment. Thank you. And also to make sure that all our patients, if they can tolerate it, are practice source control by putting up a face mask, a cloth face mask for the patient and maybe their family members around them, and that our responders will have their mask onto them to make sure that they are not being affected. And then also what they need to understand is that when they are sick, they shouldn't come to work. They should contact their departments and follow up their procedures, what they normally should do if they're recovering from an illness. And we all know that there's a quarantine period that they need to spend when they've been in contact, waiting for the results, or even after they've been tested, that they need to stay at home and make sure they're not getting into contact with anybody else. So they need to make sure that they've follow the procedure according to the department or from the state or from the country. And also then that if you're be able to work and come back, to take that extra precautions by wearing your mask and monitor for any symptoms about 14 days after you've been exposed. And then while wearing your face cover, if you've got a fit tested N95, to make sure it's still good integrity, and if anything happens to that, that you need to destroy that. If you don't need to have that, you can use a face mask, and unless you are performing a aerosol generating procedure, as we see before. And also to make sure that if you use the respirator, if you've got facial hair and you don't want to shave off your beard, and that's for the males, that you need to make sure about your fit test and a seal leak test around your face to make sure that it's still fitting it properly. Your disposable gloves, that you wear the proper size for yourself. Well, if you use eye protection, your face goggles or the face shield, to make sure that you wear it properly, and that when you remove it as well, that you perform hand hygiene, the same with your gown or your apron. Also, when we spoke about following your guidelines, if you want to reuse or reprocessing, and if you're, and this on WHO and CDC and Africa CDC's website. So we need to follow procedure, making sure that you are doing it properly. And we know that with the reprocessing of the N95, there's still a lot of controversy around that, and they're still testing. So we're not 100% sure how to exactly do that properly. So if you want to do that, make sure you do have the protocol in place to do that. All our patients, if they wear the face mask or cloth mask, to make sure that they also understand how to perform hand hygiene, to put it on properly, remove it properly, and then to use alcohol-based hand rub or to wash their hands. If we clean their department, to first clean and then disinfect. We have to launder any personal protective equipment like our gowns or our uniforms if it becomes contaminated, and that's why we normally try and advise them if they're in close contact to wear a water repellent gown or an apron over that. And if they've got just an apron, how to perform and make sure they clean their arms. And then also use your alcohol-based sanitizer with at least 60 to 70% isopropylene in that, or at least wash your hands with soap and water. So what we want to do is, and part of standard precautions, which we know should always be in place at all the time with every single contact, that is for anybody, not just our first responders, but anybody that comes into contact with the patient. And part of that is also to perform proper hand hygiene before and after any of our activities. And to remember that gloves are not a substitute for good hand hygiene. A lot of personnel forgetting that they are keeping touching their face. So we need to prevent and try and avoid touching our faces, and then also put in standard transmission-based precautions as soon as we know what is the condition of the patient. So if we look at the PPE, and we know there's a lot of talk about PPE and what type of PPE, but we also need to understand that if it's not possible to maintain your 2-meter distance, that you can wear your disposable gloves and your plastic apron or gown. Recommended your disposable gloves that should be worn, and remember, this gloves need to be replaced between every single patient. You can't carry on with your gloves and just clean your gloves and then carry on with the next patient. You have to remove your gloves and put on a new pair of gloves. If there's a risk of splashes, then you have to put on your goggles or your face shield over your face mask that you've already got in. And then also, when you want to use your facial mask, make sure that you fit it properly with that metal plate over your nose. Make sure that it fits properly so there's no around them. Clean your hands properly. And as you can see that, we use a lot for our healthcare work to be able to have enough proper PPE for them. And that's why we want to make sure that we don't misuse or abuse the resources that we've got. So please just use your PPE as needed and as required. And in the next slide, you'll see what we've sent to you. For the level of care, you need to look at what type of hand hygiene or PPE you're going to be able to use. Can I just mention there's people that are still trying to raise their hands. Please put your questions and answers in the question and answer box, and we will respond according to that. So if you've got a suspected case of COVID-19, you'll want to have at least 1 to 2 meter assessment between you and the patient. You'll have hand hygiene, medical mask, and if you're going to touch the patient, then you'll use your gloves. If you're driving with the patient in a compartment that's isolated, hand hygiene and your mask, and even the same as if you're driving with the patient without a patient, you will also wear your mask. Also, depending on your country, in South Africa, where I'm from, it's compulsory for everybody to wear face mask when you're out, even when you're driving and when you're walking into facilities. So this will also be for all our first responders. Suspected of a confirmed case of COVID-19, require medical transport, and you're not performing any aerosol. All you need to do is your hand hygiene, your medical mask, your gown, your goggles, and gloves if you're going to touch the patient. And if you are aerosol generating procedure by intubating the patient or needing to suction the patient, then you'll replace your medical mask with a N95 or a FFP2 respirator. And if you are cleaning your ambulance afterwards, or if the staff that are going to clean the ambulance, they need to also make sure that they perform hand hygiene before putting on their PPE, and also afterwards. They will need to just have a medical mask on, a gown to protect their clothes, face shield or goggles, because if you are and not just spraying or fogging, there could be some aerosol happening there by splashing into your face, and then also your gloves. And here's just a slide of what we've got in South Africa for the emergency services, if they need to be able to transport a patient. So the clinical staff will use a surgical mask. The A40 suit, apron is not really practical, especially if it's a windy situation. Non-sterile gloves and just your eye protection. If the clinical staff will be intubating or suctioning, the surgical mask will be replaced, as I said, by the N95. We'll still use the suit and the non-sterile gloves and the eye protection. If you've got a suspected COVID-19 patient, while it's being transported, surgical mask, and the patient will also then have a mask on. The cleaners that's going to clean the vehicle or the department, if you're in the emergency unit as well, they need to wear their surgical mask, the apron, the eye protection, and then they normally wear the long rubber utility cleaning gloves that goes up to the elbow, and then also they normally work with. So aerosol generating procedure, and I think most of us do know what it is, but just for even before at the ambulance where they could get to the patient, if they need to perform any of these, they will then put on the N95 mask. If they need to ventilate a patient, oropharyngeal suctioning, endotracheal intubation, if you're nebulizing treatment for the patient, could be asthma or patient is short of breath. If you need to do continuous positive airway pressure as well, biphasic positive airway pressure, you'll also need to make sure that you've got your N95 or your FFP2 on. And if you do a resuscitation involving emergency intubation, remember that aerosol generating procedure. And if you just do your normal cardiopulmonary resuscitation. Our providers must exercise caution when performing these procedures and only when it's really necessary. But also remember, we always need to take the patient's safety and the patient's health into consideration. And that's one thing that we wanted to make sure that people also understand. We need to just think about the total patient and not just about the COVID-19 symptoms, but also ask more questions and find out exactly it could be completely not related. And to decrease the droplet generation, we could also consider meter-dose inhalation instead of the nebulizers for the patient, and to make sure the ventilator with a HEPA filter on the exhalation port. And we spoke about cleaning, and we see here before patient transfer, we want to allow some air to go in, so open up the doors at the back, so make sure there's good ventilation happening. And if you do have supplies, if you have your yellow caution tape to demarcate the area where you're going to work with the patient next to the road or wherever you're responding to, make sure you've got proper PPE, your leak-proof biohazardous bags or your garbage bags, your disposable rugs if you're going to clean and use your soap and water before the time, your alcohol-based hand sanitizer, and this is for your hands, your absorbent towels that you're going to use, or your bleach or your alcohol-based disinfectant solution after you've cleaned, or if you use disinfectant wipes. The decontamination team, normally the vehicle operator and patient care provider, or it could be a separate team that comes and clean the ambulance or the vehicles afterwards, or even in the departments if you're in an accident, an emergency unit. Cleaners that comes up and come and clean afterwards if there's any spillage or anything. And every day, at least once or twice, they will clean the department and then do a thorough cleaning or terminal cleaning at the end of the day. Unless there was a positive patient, and then it's an isolation area which you would also do terminal transferred. So you will be cleaning all your visibly soiled surfaces, and then you'll decontaminate if you want to clean, start from the top to the bottom. All your contact with the patient or the materials, especially your frequently touch areas, we need to make sure that we clean before we disinfect, because you can't disinfect cleaning. And if you're using chlorine, to make sure that you're following the right solution mix. There is guidelines exactly and in them with people. We need to also remember that the coronavirus is a lipid envelope, which make a wide range of disinfectants quite effective, and even soap and water. Ensure adequate ventilation after the time as well, to making sure that you get a good ventilation, especially if you use chemicals there. And then also to just is dry before you start going on. And then just one thing we want to make sure that people understand, this is nothing different from what we would normally have done if we had an infectious patient there, or if you want to clean the ambulance or the department before the time, you clean and then you will disinfect afterwards. I think we also need to understand that if there's any waste, the waste will also be done in the same way that you've done with your normal infectious waste. So your linen also will be sent to the laundry. You don't shake them, you just roll them up, put them in a bag, which is marked, and then go to the normal standard procedure. So if you're in an ambulance, you will take it to your department where you normally goes to, either the hospital or your own department, where it will then be laundered the right procedure that you normally have. If you've got any wipes or any waste that you want to discard of, it will be discarded in your normal infection prevention methods by putting it in a yellow bag, or depending on the country where you're in, what is your regulations at your department. You will handle it as normal infectious waste, label the bag, it will be taken to the area where your waste is normally being stored, and then before it's being removed. And you follow the same procedure. And very important, as well as we've mentioned before, it's very, very important to perform hand hygiene before and afterwards. We need to make sure that we've got the right policies and procedures to ensure that they've got safe donning and doffing, and also practical sessions with them. And I think we need to understand as well, and we've seen that in the past, where people take off all their PPE, not thinking of how they might have contaminated themselves, and then they hygiene afterwards and then get infected. And also to make sure that they get enough training and refresher trainings on a regular basis, understand what it's all about. Also, occupational health and safety department need to be notified. They need to make sure that they've got the adequate supplies, and then also that we want to test them on a regular basis. And we said before, if possible, if we can test them at the beginning of each shift, and making sure that they've been screened prior to entry of the facility, taking the temperature, asking them some questions, and if there's any fever, what to do from there, and if they need to be taken into self-quarantine, and if they've been exposed, and then also to manage that and see exactly how you can do that, make sure they've got enough staff to take over from there, because as we said as well, there's a load on our staff because of people getting sick. They work longer hours and have to work without any rest. So we want to make sure that people understand how to protect themselves. And yes, just supposed to show you, we need to make sure you keep your safe lifting, use your PPE, and also making sure that because of spillages, damage happening there where you can slip and fall. And also, if you want to lift people up, wash your hands. Again, like we said before, hand washing is one of the most important aspects that we can understand. So before you're putting on your PPE, and even after you've removed all of them. So if you do have to cough as well, remember, don't remove your, if you remove your mask, cough in your elbow, or if you use a tissue, you can cough into the tissue, dispose of the tissue, perform hand hygiene before you put on your PPE again. And then also maintain a social distancing if possible, and also to make sure that you don't keep on touching your face and especially your nose and your mouth on a regular basis. And here's just to talk about the facial mask as well. If they don't have any face covering, we need to have at least samples that we can have and give to the patients and to the family members if they are traveling along. We normally also send under 2, and we follow the WHO guideline on that to make sure that we understand. And then also remember, some of our patients cannot manage safely to keep the mask on their face without feeling that they cannot breathe. So we need to make sure that we do anticipate that as well. If you use a nasal cannula, the face mask should also be ideally worn over the cannula. Alternatively, an oxygen mask can also be used if it's clinically indicated. And then the staff also need to wear their mask and keep also their safe distance between them and their co-workers. There's also the hand hygiene is very important for them. And here's in the emergency room, also minimize the number of clinical interactions that a patient, when you're exposed to. Multiple and repeated clinical assessments should be avoided unless it's really necessary, depending on what type of patient you have. Remember, we don't want the patient to die of a heart attack because we were too scared to handle the patient. We need to at least perform all the necessary clinical interactions that is needed, but also just to also keep safety in mind. And then always to make sure about training, the adequate supplies. Patient care equipment need to be decontaminated between the patient's use, afterwards as well, after body and body fluid contact. And if we look at the 5 moments of hand hygiene from WHO as well, and also at regular intervals, you need to keep on cleaning. Also appropriate storage location for this equipment, so it could be well decontaminated and cleaning and relocated, so it's not too far away as well. If we talk about like ultrasound machines, out of a high-risk area, but we want it to be close by, that if we need it to be, if we don't waste a lot of valuable time going to try and fetch it. And then environmental cleaning is also important. And remember, we say environmental cleaning, not environmental disinfecting. Environmental cleaning is important between our patients and even with us on a regular basis. And if we follow the guideline, we say at least once a day, but if we can, 3 times a day if possible, depending on the staff and depending also on the amount of patients and the flow there. We want to make sure that we restrict access to visitors, that we can keep social distance. And then also exceptions might be considered on the basis of who is critically ill, dying, or socially vulnerable children that you can't need to leave alone. You need to have a competent adult with them. Need to make sure that we understand exactly also the social interaction that's happening there. The staff also need to consider this strategies to reduce the risk for the patient, so that patients don't feel stigmatized or frightened as a result of the PPE. I think from a healthcare worker side, and if you look at being from a patient side as well, that we need to remember that we need to speak to the patient and not buff and over the patient, and explain to them what we are going to do and why we put it on, so that at least I can feel that you understand from their side as well. We need to remember that our patients are coming into our accident and emergency unit most of the time are very frightened, they're in pain, and they've got a lot of fear happening. So we need to want to understand as well what we are going to do. So we want to clearly explain to them what is the situation and what is going to happen to them. And then also, if possible, that we can have posters and some clear signage available for them. We spoke about environmental cleaning, and we really need to understand that when we clean, that we clean and then we'll disinfect at the end of the session, and not disinfect just as routinely. But we would normally disinfect, especially your high touch areas like your doorknobs, bedside table, the front of the bed and the side, the drip trolley, and then also we need to think about the curtains as well. Sometimes we keep on forgetting about the curtains between the patients that also being touched on quite a regular basis, so we need to replace that if possible. Then additional strategies that we want to have, we want to make sure that there's separate waiting areas for different ages, your children under 5, and then with the adult with them. And then also if you have your different areas of waiting, that there's enough distance between them. We want to warn patients as well what's going to happen. Make sure they don't sit there for a long while before you could walk to them. At least have maybe an admin person available that could maybe talk to them and guide them into explaining exactly what is happening. And as you can see here, as and we here in South Africa, especially, is this: if you do go and see the doctor, you're not allowed into the waiting room. You have to sit in your car and wait until they phone you to come in. But then also make sure that you do keep it from them, and that there's space that they can see exactly where they can sit. So if you have chairs, you can maybe mark this chairs where one can sit, the next one is not available. Also have your hand hygiene stations available for the patients with clear signage how to use it as well, and then also to indicate to them where to go. So if you do have somebody that can guide them on exactly what is going to happen to them. Then if you think about your critical infrastructure workers that might be working and exposed as well, but could remain asymptomatic, please try and pre-screen the employees when they come to work, making sure that they can still continue working, do regular monitoring of them. They have to wear their mask, and they can have supply them with a cloth mask. For your critical infrastructure workers, have to try and keep social distancing, and then clean and disinfect their environment as soon as they are done. So alternative considerations as well, if we think about our calling center at the emergency departments, even for our ambulance services as well, that even the people are working there that could be come in contact with other people in and working there, that they don't share their headsets that are something close to our nose and our mouths. And that also includes our cell phones that we tend to keep forgetting, that also needs to be cleaned properly, and also the frequency of cleaning the area around them, so their keyboards, their telephone, if they touch anything, that we need to make sure that even for them there, it is clean. And then accident and emergency unit at the area where the nursing station will be, make sure that that will also be getting cleaned and properly ordered around, making sure that you clean the keyboard, the telephone, the area where they keep on touching, the side where they're standing with when they're making notes of the patients, where the doctors come and hand over the notes, and then also to make sure that they've got enough PPE available, and then also, if possible, that they can take their breaks in between and that people can stand in for them, and that there's not a lot of big congregations happening in the tea room. And we find a lot that is also where contamination, or where people get infected, because they remove all their PPE, go to the tea room, and then all of them talk and hug one another and say, oh, what you see what we've done. I've had such a bad day in X, Y, and Z, and they carry on. Also, don't share your food utensils, making sure you wash them properly with soap and water, and then we can help one another to ensure that we have a safe environment for all of our workers and the visitors and even our patients. So if we do ask the workers to take their temperature if they come before work, especially if they're in close contact with possible patients with possible COVID-19, that they wear their face mask at all the times, practice their social distancing, and if they're sick, don't share their utensils or their equipment between them. And if you do take a break, make sure that you keep on with your social distancing and cleaning. And then with the employees, we said as well, they need to follow the policies, look at the policies, review them, making sure there's enough screening available, and if people are sick, that they can go home immediately, not stay on the shift or still work and then send home, that they've got a team that can stand in for them, making sure that they've got the right face mask to use, and that if they are decontaminated or reused, it's been done properly. Ensure that you increase air exchange in the building, and also then the frequency of cleaning around you. Then we spoke about stress and burnout, and there was a study done with 1,257 frontline workers in 2020 by Kang, and they've said, especially in China, described the challenging conditions faced by medical staff with a significant stressor summarized, and they say in this medical staff survey were found to have considerable rates of depression, about 50.4%, anxiety 44, nearly 45%, insomnia 34%, and 71.5% of the participants had non-specific symptoms of psychological distress. And this also identified that women in these frontline roles is mostly severely affected and at a higher risk of depression, anxiety, and increased distress. And if we look at the stats as well, we see that a lot of our staff is also mostly female. So I think that's one of the reasons why, but we need to think about how can we care for them. So part of this is also the reasons why: shortage of staff or your protective equipment, lack of clarity about what to use, so not enough training for them, the intense scrutiny of international reports on the media about all the increased amount of cases, and people really get quite upset and depressed about that. Isolation, if you need to go into isolation from your family and other supports and you're on your own for 10 to 14 days, a lot of people cannot handle that on their own, We need to think about how we can help them to take this through this period, what to do and how to do it. The fear of transmitting this disease to their family members and other people at homes when they're working with patients as well. The expanding workload, the depleting workforce because a lot of them are getting sick and even getting killed. The incident of hostility and even aggression towards medical staff from patients and even from the community as well. And we've heard as well in some of the other countries that the community don't think it's really existing, and they really think that they're just wanting to make money out of them. So they don't want to really adhere to the rules when they come to the facilities as well, and they actually abuse the staff a lot, and then the staff still need to carry on. So sometimes when you want to notice that if you're feeling any of these symptoms, that you need to understand that, you know, it could be a reason and we need to take something about it. So feeling irritation, anger, or denial, you a lot of time getting anxious where you normally wouldn't be an anxious person. You're feeling very helpless and powerless. You lack the motivation to do anything or to carry on. You're feeling tired or overwhelmed, sad or depressed, or you can't sleep. If some of these are happening after, you know, you've been exposed to this and not a general idea before even the COVID started, we need to really think about what is going to happen. We need to know about stress-related disorders and what to do and who to talk to. So part of what we want the employers also to make sure that there's a method that the staff can actually go and talk to somebody, even if it's their co-workers or their supervisors, and they can talk openly without feeling that they're going to be stigmatized or having people thinking that they just don't want to work. We need to identify the factors that can create this stress and how we can help them to work through that. We need to remind everybody that it is an and especially if you've got limited resources, it even makes it worse. We need to identify and accept that, you know, certain things that there's just no control that you have over it. There's nothing you can do about it. You just need to work through this. But it might be helpful to know that, you know, you can talk to somebody. And it sometimes just helps to just talk through something and just realize that, you know, while you're doing your best, this is all you can do. We need to try and make sure that we can try and get enough sleep and rest. Try and eat healthy in between if we can. So even if you work very long hours, to at least take some healthy foods and snacks in between with you. If you do have a time, just in between patients, even if it's just 5 minutes, just go and stretch, just walk out into the open, just breathe, just relax and just come back. And then when you are away from work, in the time that you are off, try and get some exercise, spend some time outside, do something that really relaxes you and you like to enjoy. Even trying to take a break from just watching all the news and all these social media, what's coming up and, you know, how far the cases are increasing and how many people have died. And then also to realize that, you know, when you start using more or misuse alcohol or any other prescription drugs, to also start taking and thinking about asking for help. And also when you've been treated, to make sure that you continue with this until you're feeling that the symptoms are getting better and not worse. Okay. Then I just quickly want to talk about the correctional services, and we know that there's also a lot of ways that people can get contaminated for the inmates, even for the people working there, for the visitors as well, coming to visit them. We need to think there's some symptoms that we can put into, strategies that we can put into place to stop spread by regular symptom screening for our inmates, for the staff, for the visitors, isolating people if possible with symptoms. And we know it's not so easy in the correctional services because there are a lot of overcrowding, but if you can, it's possible, even if you have to put them into isolation or in detention. If you can perform physical distancing, which is sometimes very difficult in the correctional services, but rather outside as well, where you've got some good ventilation instead of bundling them up inside. Make sure there's intensified cleaning happening in the facility as well. Get the staff some infection control training, even if you can do the basics for your inmates, if they also understand about hand hygiene and hygiene overall, cleaning around them, proper cough etiquette as well, and then to mention if they do have symptoms, disinfect also your high touch areas and the face cloths as well. So if you think about as well, we need to develop operational preparedness by sharing information, how we're going to take it over. We need to review our disaster plans, and especially for any pandemic or any outbreak that could happen, not just with COVID, but also we need to coordinate with local law enforcement and court officials, making sure that all the people are in the facility to take the actions to protect themselves by wearing their face masks, perform hand hygiene, and then also make sure we ask the questions and communicate right through the facility on what is happening and what they should be looking for. So also we spoke about if they are infected with not displaying the symptoms, it could spread very quickly through the facility, but also if we can reduce the visits and the people coming in and getting in contact with all of the inmates, but also to make sure that we test even the asymptomatic individuals and initiating medical isolation as soon as possible. And then also one of the things as well, I think important is to display around that people understand what to do. Wash your hands, cover your cough. If you greet, if you touch hands, rather do it by elbow and then clean your hands, and then the impact. And then also important is to display a number where people can notify departments or they can contact somebody if they need to know anything. So the 24-hour hotline information number that each country might have. They sometimes have a WhatsApp number from the Department of Health, or just an operational center number that one can actually display, that people know where they can actually get more information and not just listen to all the different confusing stories on the social media as well. And then just as this golden rule take-home message for all of us is to also remember that standard-based precautions is something that should be there all the time and with every situation. That the call centers adjust the type of questions that they ask so they can get the most information about the patient, so that the responders that are going out understand, or even if they're waiting for a case to come in, that they know how to prepare themselves, also to follow their standard procedures, environmental cleaning as normal, and disinfect your high touch areas, waste management as normal, infectious waste, and the normal procedure to be happening, and following from there. Only use your PPE according to the risk assessment and the procedure that you're going to do. And as we said, we're trying to reduce the wastage of our resources, and then keep your mental health in mind and seek advice if any of the symptoms appears, and always be safe while we are saving lives. There's just some references, and I think a thank you also sometimes go a long way. If we can just say thank you for all these people that work so hard to really help us, and the community as well should also understand that there's a lot of extra load on them. So I thank you, and there's now time for questions. So over to Dr. Wande.
Thank you very much, Anna and Susan, for very rich discussions. So I think, colleagues, you have been putting some of your questions on the Q&A chat box. Keep them coming. We will be able to address many of your questions today. On my panel today, I have colleagues from US CDC, from Public Health England, from Africa CDC, Resolve to Save Lives, and of course, ICANN colleagues. So this week, we are going to be fully answering your questions. We know some people had already posted some questions and sent them via email earlier. We will try to do our best to address some of these questions. So very quickly, I think the first question will be to you, Anna. This person wants to know should you be wearing a face mask while driving? I would assume that while driving an ambulance or a transport vehicle taking people to the hospital.
Okay, I want to answer from this perspective from South Africa. With us, it's compulsory for people to wear a mask, especially if you're more than one in the vehicle, and you know, keeping the windows open as well. We advise that. if you're a single person in the car, you've got the windows open, you know, I myself don't wear a mask when I'm on my own in the car, but it is compulsory for us in South Africa. So depending on your country as well. But remember, when you are traveling and wherever you are, you do a risk assessment of the situation. So if you in a vehicle and you're in the back of the ambulance with patients, you will wear your mask. If you're sitting in front and you're the only one in front and you're driving and you can open up the windows, you know, for me, then at least you've got enough ventilation happening and there's no contact that you could be getting into contact, because at the moment it's not airborne, only when you're doing aerosol generating procedures. So when you're driving, yes, if you're with more than one person in the car, then you'll definitely wear your face mask. Thank you.
Great, thank you for that. I think I'm going to throw this other question. I know that some of my colleagues have been doing a bit of typing, but just for the benefit of other participants, Emilio, if you'd like to take this question, is that looking at the environmental cleaning guidelines that Africa CDC has published, this participant wants to know that does this include isolation areas other than healthcare settings, such as did we consider places like for cleaners, for cashiers, and for other supportive staff? So if you'd like to answer that on behalf of the IPC TWG.
Thank you, Wande, and thank you, Dejeni, for the question. So yes, we have an environmental decontamination guideline that's been published by Africa CDC and is available in 4 languages, in English, French, Arabic, and Portuguese. And that does have a section on the principles for cleaning healthcare facilities and also the principles for cleaning and decontaminating non-healthcare facilities. These are broader principles, so you'll need to take that general guidance and make sure that it's made specific to the area that you're considering. So we do have that guidance, as well as there is, of course, the WHO decontamination guidelines that give you some more of the technical specifications for some of the cleaning disinfectants and chemicals. But yes, the guidance is available. Thank you. Over.
Emilio, this is Elizabeth Bancroft from CDC. Do you want to touch briefly upon, and sorry to jump in and ask this question, Wande, what the major differences are between cleaning a healthcare facility versus cleaning a non-healthcare facility, like where a cashier or someone else would be?
Hi, Elizabeth. Thank you. Yes. So the principles are still the same. That's the key thing, that if you want to decontaminate a surface, you would always start by doing cleaning to remove any physical dirt. And then you would be following that up with using a disinfectant. But there are some differences in what sort of structures are in those environments. So in healthcare facilities, you don't have surfaces like carpets and soft furnishings. So the surfaces are in some ways easier to decontaminate, but they are also often touched by more people and so require more frequent cleaning regimes and decontamination regimes. But general public areas, they might be busy, they might be crowded, but they're often the equipment and the sort of the items in those environments are different, so you might not be able to use the same disinfectants on them. So I'm not going to go into all of the details of the procedures and protocols, but those address some of the differences. If there's anything else you would like to raise, then please go ahead. You might have something in mind. Over.
Great, thank you so much, Elizabeth and Emilio, for that. I hope the colleagues on the call, participants, feel free to ask us more questions about the areas on environmental cleaning. So very quickly, Karen, I will throw this question at you because I know that a few weeks ago we had a rich discussion around ventilation, and we've really talked about the use of air conditioning and things like that. So this question just says that, is air conditioning rooms suitable for sample collection? Karen, if you'd like to touch a bit on that, then we can also take inputs from other colleagues on our panel.
Yes, good morning, good afternoon. Thank you for that question. It's a bit complicated. Sample collection has been discussed, and there are differing recommendations as to PPE. The bottom line always is adequate air exchange. Air conditioning, generally speaking, will cool the room and make you feel better, but you must be sure that there's enough air circulation especially where you're collecting a specimen. And if you're concerned about airborne contamination when you collect a specimen, then there really does need to be at least 12 air exchanges per hour. Most of us recommend mask and face shield when you're collecting a specimen, not an N95. US CDC recommends an N95. This is controversial, and the problem is that with aerosolizing particles, as Anna discussed, that is when you do get airborne and you do need an N95. Whether specimen collection falls into that category or not is open to discussion and debate. I would say the most important thing about specimen collection is not to do it in a tiny room, because it would be very difficult to maintain ventilation there. I defer to other colleagues if they want to discuss this further. It's complicated.
Yeah, so I think the essence of this IPC webinar is really to tackle on these complicated things that are not clearly written and are a bit context specific. So colleagues on the call, Elizabeth, Anna, Emilio, if you'd like to jump in and sort of unpack this particularly interesting question that has been raised by our participants.
Sure. So this is Elizabeth again from US CDC. And when they said specimen collection, I wasn't sure what kind of specimens they were referring to, because anything that's sort of like blood or, routine specimen collection, then I agree it's the standard face shield, mask, and air exchange, because you're just getting close to a patient, but it's not necessarily aerosolized generating. So I think that's sort of easy. US CDC does recommend N95s for anything that might generate a cough or a sneeze reflex. And that could be something like getting a nasopharyngeal swab or an oropharyngeal swab. And so they consider that to be potentially an aerosolized generating procedure, because you might be inducing that kind of reflex. Even if a patient doesn't want to cough or sneeze, they may naturally do so when you stick something, way up their nose or in their throat. And that's the rationale behind the CDC recommendations for that. But we do recognize that WHO does not put things like N95 or oropharyngeal as being aerosolized generating procedures. And I think, we're all struggling with the science and the evidence to make our recommendations. Over.
Fantastic. Thank you very much for that. I think that has been really useful. So we can move on to some other questions that have been posted on the group. So really, this question I think is directed to Africa CDC. I know Emilio has done a good job trying to answer it, but I'm happy to take comments from also Mohammed, who is on the call. Otherwise, I could take it. What can we do in situations and places where there's shortage of running water, problem of unavailability of face mask, and this person cites an example like in Nigeria. So Mohammed, if you're on the call and you would like to take it, otherwise I'm happy to address it on behalf of Africa CDC.
One day, please go ahead and address it. Over.
Fantastic. So you have raised important challenges that we face as a continent. We understand that there's limited access to basic water, limited access to PPE supply. So as Africa CDC, what we've really done is, you'll notice that Susan highlighted one of the guidelines that we provided, just to an alternative way to ensure that water is available through hand washing stations are available through using a few household items, and telling people on how to get stationary and or hand washing facilities. So those are looking at very urban, rural areas. So looking at things around TP taps and foot pedal operated hand washing stations. So what we've tried to do is providing those guidelines as part of our continental response. You may be aware in previous updates, we tried to highlight some of the work that we have been doing. We have been able to distribute PPE supplies across all of our 55 member states. We've worked with private sector and donor agencies, along with the continental COVID-19 response funds that we are using to supply some of the PPE materials to our countries. So we are continuously working with countries to ensure that we address issues around PPE shortage. We also published a guideline to address that and guide countries so that they are not wasteful in terms of using PPE. So I hope that has answered your question. I will go to the next question. And really, Anna, maybe this should be to you. It's really on how do you go about resuscitating a COVID-19 patient who fainted?
Okay, one day, I'd like to just type for them, if you've got a COVID patient that fainted, if you've got your N95 and you've got your gloves on, you'd carry on with your performance like you will do CPR. Just make sure that you are protected with your contact and possible airborne, because if you do have to use the patient, if you know the patient just fainted and you're not going to perform decompressions, you can just have your mask on and your gloves and your gown, and then just try and revive the patient. But if the patient is actually needing to have compressions, if you need to do cardio, CPR, you will carry on with your N95 IPC, because we're not sure about the aerosol generating when you do the compressions. So you carry on with the normal way by just making sure you've got the right PPE on. Thank you.
Fantastic. I see that my colleague from WHO Geneva, Alice, just joined our panel. So if you, Alice, thanks for joining. I'll just throw this question directly at you. This question just says, is cloth mask suitable for use by healthcare workers? I would assume it means in healthcare settings.
Thank you so much. Hello, everyone. So we do not at WHO recommend cloth masks to be used by health workers, as they are intended to only be used for source control at the moment, and health workers need both the protection and the source control. So for that reason, we recommend medical masks be solely used by health workers in healthcare facilities, and by anyone who is providing care to a suspect or confirmed COVID patient for that matter. Thank you. Over. Wande, are you still there?
Thank you very much.
Yes, sorry, I was struggling with the mic. So thank you very much, Alice, for that good response. again, the question, I think our discussion is really unpacking a lot of things around handling possible COVID-19 patients. And Anna, I don't know if you touched on this during your talk, but the question is saying, is there any risk of handling blood samples from COVID-19 patients?
Wanda, like we said before, I mean, it's the same as what you've done with any other infectious patient. So we want you, if you know there's going to be a contact with body fluids, you need to protect yourself with your gloves, your repellent gown, your face mask, and then just perform the normal, how you would handle contact with body fluids by, as soon as you're done with that, you perform hand hygiene and then you carry on. So it's nothing different than from any other infectious contact with body fluids or blood. They follow the same IPC principles than before. Thank you.
Fantastic. Thank you very much for that comment. I think our participants just need us to reiterate and reaffirm these precautions for them to apply in their daily lives. This question I will just try to address. It says, how can we obtain the guidelines on principle of cleaning healthcare and non-healthcare facilities? Decontamination has not been talked of, and can we focus on it, especially in enclosures with high turnover? So I think I would just address that some of these guidelines are already being published on the Africa CDC website. And the benefit of being a part of the community of practice is that all of the experts on this call from various organizations are available there, and we continuously share guidelines that have been published on our various institutions' websites. So all of the principles around healthcare and non-healthcare decontamination are available on different websites, and in that community of practice we try to send that. About 2 weeks ago or thereabout, I know that Prof. Shine talked a bit on this, so I don't know if Anna, you would like to tackle that. Hello?
We can hear you.
Yeah, fantastic. I don't know if you like to talk a bit about that, Anna, in terms of air decontamination. I know we did, Prof. Shine did a fantastic job walking us through natural ventilation and considerations for healthcare and non-healthcare facilities. That is available on the presentations that have been shared. So Mr. Bashir, if you would like to put your email there, we're happy to send the slides to you.
Wanda, I wanted to say that, you know, I'm not the expert, but I think Karen, that's on the call as well, been working as well. I think she's more experienced to discuss this. So I want to hand it over to Karen, please.
Sure. I think, as Wanda said, Shaheen's talk was one of the best I've heard. In terms of cleaning and disinfecting, and decontamination, I'm not sure the specifics of the question, but I think that as discussed before in Anna's presentation, you clean first and then you disinfect. And these are fairly standard. This is a pretty easy to kill virus, thank goodness, outside the body. And the purpose of cleaning is to remove visible particles. The disinfecting is really to make sure that you've eliminated residual virus. And I think there are any number of disinfectants, and it depends on what's available in your country. There's a very nice infographic that is available that shows you how to dilute solutions of chlorine, depending on what your concentration of chlorine is you start with. If you have 70% powdered, then there's a way to make strong solution, which is 0.5% for any blood and body spills. If you then dilute it further, you make 0.1%, which WHO changed its recommendations in June. That's for almost everything else. And then the weakest or mildest solution would be 0.05%. That's if you need it for linen soaking And as a last resort for hand hygiene, if you can't get alcohol-based hand rub, or if you don't have soap and water. Perhaps we can refer you to, WHO has an excellent site about environmental cleaning, as does Africa CDC. I don't know if that helps. There are more specific issues. I'm happy to try to address them.
Fantastic. Thank you so much, Karen, for that. I think that has been helpful. So I think we had tried to answer, Alice, you tried to answer this question around guidance for health workers to use cloth mask. So I think someone else is saying, why is this not safe to healthcare workers to use cloth mask? So Alice, if you'd like to further explain so that our participants fully understand all of the guidelines that we have put around the use of cloth mask and the appropriate people to use this. Over to you, Alice.
Sure, thank you. I can expand on that a little further. So the reasoning behind this is that, unfortunately, cloth masks, especially the ones that are being made at home or being made and sold in the community, are not standardized. So they are not made out of material that has been tested and has been confirmed that it provides a certain level of protection. So when you compare it to medical masks are all made from similar materials that have been tested numerous times and standardized according to international protocols, and they provide a certain percentage of protection against particles coming in and out of the mask. And so for cloth masks, there is not a single company or producer that can make these and have them tested and tell us exactly how much protection or if they even are protective for the wearer. So there is a lot of research going on in this area, and WHO has actually just posted their new guidance, or not new, but updated guidance in June on the cloth masks. And what the research shows us so far is that if you do combine several layers, they say a minimum of 3 of various materials, and they give specifications in the guidance of the first one being a droplet absorbent material, and then the outer layer being a droplet resistant material, and then an inner layer as a filter or another layer. That would provide a little bit of protection as source control, but it is still not suitable for the health workers to wear this, as they do need protection from droplets. I'm going to post in the chat a link to our page on masks, and it has all of our materials there, as well as all of our technical guidance documents on this. But just in summary, so cloth masks are not standardized, and we cannot guarantee that they are made out of material that can be protective for the health worker. So for that reason, and until we do know what materials they can exactly be made from, we do not recommend them for health workers or anyone providing care to COVID patients, because we cannot guarantee that they have a protective value. Over from my side.
Wanda, can I maybe just come in here as well? You know, I totally agree with what Alice said, because if you look at the different cloth masks that's available, even if they say they've got a respirator in, and if you just touch on the mask, you can actually feel some of them, it's got basically nothing in, and others are so thick that you can't actually really breathe through them. So I think that's important, why we need to look at the guidelines that's coming out from WHO, and understanding that the reason why we want our healthcare workers to use, you know, the surgical, the N95, and not the cloth masks. Over.
Fantastic. Please, colleagues, keep your questions coming. I know some people are putting it in chat. Unfortunately, I'm trying to take only the questions from the Q&A chat box. So this question is quite interesting. It says, when someone sneezes with his elbow bent, will the pathogens remain in his or her elbow? And yes, can the surface be, I assume it means the skin, can the skin be disinfected? So I think I would make that question open such that my panelists are able to give input onto that. So Elizabeth, if you would like to go first. Hello?
Wanda, I don't think she's on the list anymore.
Okay, fantastic. Anna, if you'd like to, since it's an open question, we can just move to you, then Karen and Alice all chip in.
Okay, you know, what we normally would say is that, you know, if you do cough into your elbow, you really need to make sure that, you know, there's cloth in there as well. If you cough into your normal elbow like this without the cloth material there, you can just wipe it down. I mean, you don't need to disinfect it really if you want to. You can just, if there's wetness, just wipe it down and just clean it. Remember, you're going to struggle to really get your elbow to your mouth, you know, to breathe in, and you're going to not keep on touching your elbow. That's why we're asking people to do that. But I think just to, if you want to be sure, just wipe it down with a cloth and then just make sure it's dry. But normally if a patient sneezes, if it's a COVID patient, then, you know, you can just think about cleaning around it. But I mean, we normally don't do that in regular when we sneeze or cough. So I think we just need to remember that, you know, we need to follow the same principles. So if you do cough into your elbow, make sure it's close to your face as well, and not just halfway through. So actually you cough around your elbow, that you do it properly and make sure that you do catch up on anything that is around there, that it comes into your elbow and onto the cloth around your elbow. So if you do have a sleeve on, it's actually much better. Over.
I would also add,
Yeah.
I would also add that you should perform hand hygiene afterwards. You know, as we've discussed, this is not a virus that's difficult to kill. If you cough into your elbow, the purpose is to prevent droplets from dispersing further around the environment. Could there be virus in your elbow? There could be. If you do wipe it down, make sure that you perform careful hand hygiene afterwards. The purpose of not coughing into your bare hands is because then you certainly will have contaminated hands. So the objective is to minimize the spread from a cough or a sneeze, and then for your own sake, you should also wash your hands.
I totally agree, Karen. Yes, that's something that should always happen. You know, we tend to forget to keep on saying that, but it is very important. I think hand hygiene is one of the most important things that we need to understand and realize that this is something that we can't do enough. Thank you. Over.
Fantastic. Thank you very much, colleagues. I think that has been helpful. Just to let, there are a couple of questions that are coming. Just to let you know that you can also join the Telegram group, and we can further answer some of your questions. This question I will throw to Alice. It says, can I clean my cloth by spraying alcohol?
Is this the cloth mask that they're referring to?
No, I think they're just talking about their regular clothing or something like that.
Oh, clothes. Okay. We do recommend that they launder clothing and cloth masks for that matter in the general laundry. We wouldn't recommend spraying them with alcohol or diluting them in chemicals. It's the regular laundry or water and soap or water and detergent would be sufficient.
Yeah, I would agree with that 100%, and make sure that you do not spray your mask, your cloth mask, with alcohol, because you risk getting alcohol into your eyes, which would be quite detrimental.
And this is Elizabeth. In much the same way that we recommend, for example, environmental cleaning, where first you use a detergent and then a disinfectant. It's you know, that a disinfectant alone doesn't do adequate environmental cleaning because there may be organic particles that are on the surface that will block the disinfectant from getting down to the surface and killing whatever underneath the organic particles. It would be the same thing for any cloth that you might have, that just relying on a disinfectant alone to completely decontaminate the cloth wouldn't be effective, because there may be organic particles, there may be bits of dirt, other things that you don't see that would actually block the ability of the alcohol to get to the cloth and to get to any virus that might be between, let's say, a piece of dirt, the virus is between the piece of dirt and the cloth, and thus the virus would not be affected by the alcohol. So that's why we really encourage regular laundry with detergent. And if you do it at a high enough temperature, that should be sufficient to be able to kill off the virus without needing to use an additional disinfectant on top of the detergent. Over.
Great. I think one last question for you, Anna, and I'll just try to wrap up with the questions thrown at Africa CDC. It just says that how do you recycle the N95? I think it's a follow-up on one of the questions that you were answering before. It says, is it ideal to recycle the N95?
Thank you, Wande. What we normally would say is that, in normal circumstances with the TB patient, when you treat TB patients, we allow the N95 to be reused depending on, if it's not contaminated, and that you take it off properly and store it properly, and then perform hand hygiene. But recycling as well, there's different guidelines, and as Emilio also said, the guidelines just came out, I think, last week as well. They've done different testings, and there's different ways to reuse and recycle your N95s. So I think the best will be to follow the guidelines that are coming out to show you exactly how to do it and the procedure, than to not just think you're doing it the right way. But with normal N95, we advise that it can be used up to 1 week by storing it properly in a paper bag where it's marked, and you take it off properly by handling the strings and not the front of the mask. And if you put it back on, remember the hand hygiene as well, and that the integrity of the mask is not contributed, that you really look at how the mask look like. If it's torn or you can see there's some damage, then I would rather dispose of it and get a new one. And then if it's still intact and the integrity looks good, follow the guidelines to showing you exactly how to recycle or to decontaminate your masks. And if you throw it away, it will go away, like your normal infectious waste, being disposed of in the proper way that you dispose of your infectious waste, because it's seen as that. Thank you.
And can I just add here about N95s and extended use and reuse? Frequently, the rate limiting step is the strap and the elasticity. So that's particularly important to make sure that that's maintained. In theory, one is supposed to be fit tested for N95s. That often is impossible to perform. But if the straps are not tight, then it cannot be reprocessed and reused. So it depends on how carefully you've been using it. And as Anna said, there are lots of recommendations about extending the use and reprocessing, whether it's UV light or hydrogen peroxide gas or whatever. And I think if you follow those instructions, given the shortage of supplies, that should be fine.
Fantastic. I think just a few questions that have been sort of thrown at Africa CDC. I think this particular person is really interested in, the question has my name. Looking at the question around training IPC, trainings on IPC, particularly students, and if our concern is not around students now. I think just to highlight that right now, most of our efforts are really supporting the frontline workers, but we know that because of shortage of frontline workers, many countries are starting to pull their student doctors, student nurses to support the overall response. Now, through our webinar series like this, it's open to all. We encourage frontline workers, students, and everyone to join on this to fully better understand IPC, particularly in the context of COVID-19. So in terms of what we are doing, I think through our trainings, our online trainings, we believe that we should be able to reach more students. Our analytics show that we are able to reach some students across the continent, and some countries, for example, we are doing targeted trainings for their their student nurses who have been pulled to support the frontline fight against COVID-19. There's still a couple of questions. Please, my panelists, feel free to type your answers on some of these questions on the Q&A chat. I will just hand over to Anna to take us through the wrap up for today. Over to you, Anna.
Thank you, Wande. Yes, I just want to thank everybody, and I want to thank the panelists on the call as well to help address the questions. And we will still see how many we can still answer. Remember that there is also the Telegram community of practice where you can also put your questions and we can see how we can respond to that. I want to thank Susan and Wande for helping on this session as well. Also, just to remember that you do have your QR code that you can scan for your attestation, which we display at the moment. And then we want to really ask you to rejoin us next week the same time. And remember, on Fridays we have the same session, but for the French-speaking participants, so you can advise them as well if you know about anybody that they can then listen in on Friday for the French session on this. And then there is also a live streaming on the Africa CDC Facebook as well that you can watch. And so people that are registered, they will be able to get the presentations as well that we can post to them. So everybody for attending, and have a super day the rest of the day. Thank you. Goodbye.